You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, look, if you have been told you are a loud snorer, or you have been diagnosed with sleep apnea, and you've been told you need a CPAP, and maybe you tried a CPAP, but you can't wear it because it's uncomfortable, or you just don't like it, we may have good news. With us, we have from Colorado, Dr. Taher Dhoon. He's getting amazing results with his patients with sleep apnea. Dr. Dhoon, welcome to the program.
Yeah, thank you for having me.
Good. And I know you have a training institute there. You teach dentists from all over the country. But for people that don't know your practice as far as sleep apnea, we've had you on the program before talking about dental implants, replacing missing teeth. But sleep apnea is a big part of your practice. So who's that typical patient?
Yeah, we actually have different groups of people who would qualify for sleep apnea treatment. We have the people who are getting sent to us by their physicians or who already have a diagnosis of sleep apnea and they can't wear the CPAP. And Randy, I don't know if you know this, there's about 70% of people who have a CPAP who can't wear it. So the CPAPs work, but if it's just sitting there collecting dust, then obviously it's not working. So that's one group of people. The second group of people are the ones who are snoring, and their spouses or their significant others are bringing them into our practice because they can't sleep and they're worried about them. They hear them stop breathing throughout the night.
Is a little snoring okay?
Well, and it's logical to think a little snoring is okay because it's a sign of aging. Just like worn teeth, people think that's normal, or a little bit of gum bleeding and they think that's normal. But all of those things are actually abnormal, and all of those things need to be resolved. And it's always easier to resolve something when it's in a mild or infancy type of stage versus when it's moderate or severe. We have patients who are absolutely unaware that they have sleep apnea. The humans are very adaptive. So we just acclimate to this level of tiredness, and we think as I got older, I just have less energy. I just don't have the energy to go gardening or go work out, and we just think it's a sign of aging. So people are sometimes just completely unaware of what's happening every single night. And then we have the kids, and this is a new part of medicine and a new part of dentistry where we're finding apnea in kids. We all know what a tired kid looks like. I have 3 kids under the age of 5, and if they don't sleep or they don't eat, they're a different person.
Like they have attention deficit the next day.
Yeah, and that's one of the things. Like, kids are getting diagnosed with attention deficit disorder, but it could just be inadequate sleep that's leading to...
Have you ever seen reversals in your practice with kids?
Every single day. My 5-year-old is going through treatment right now, and I'm seeing this every single day in my practice and in my own home.
Is that right? And I told you this. Look, I've had the program, the Wellness Hour, has been airing for 25 years. And 25 years ago, dentists treating sleep apnea was considered a little crazy, right?
Yeah.
Now, the medical community has acknowledged, and now they in just about every book written right now about longevity, anti-aging, prevention, everybody's talking about sleep apnea, and they're saying find a qualified dentist. So how'd you get into this, by the way?
So, first, I have numerous things that brought me to treating sleep apnea. One that kind of is like near and dear to my heart is when my father dropped me off at dental school 15 years ago. On the flight back, he had a severe stroke, and he always would snore, rumble the room. The classic. We know he has sleep apnea, but he never got it taken care of. He had to relearn how to speak. He had to relearn how to walk, and thank God he's doing great now. But then 10 years later, he had a massive heart attack. And then that was the wake-up call. Then we had some grandchildren, or he had some grandchildren, and he would do it for them. He did it so he could be present in their lives. But if you don't sleep properly, what's happening is the lungs aren't getting enough oxygen into the blood. The blood doesn't have enough oxygen, so the heart pumps harder every single night to pump less oxygenated blood to the body. Well, the brain's not getting enough oxygen as well. So there's a huge link between Alzheimer's, neurologic disorders, dementia, and sleep apnea, cardiovascular disease, stroke, and heart attack, and sleep apnea.
Because of what? These stress hormones? Because you're not sleeping.
Yeah.
Let's get that out of the way. So these people that have sleep apnea, you say could be waking up like 40 times in 1 hour.
Yeah, or more.
But they don't know it.
Yeah, so mild apnea is you're waking up over 5 times per hour. Moderate apnea is 10 to 30, and over 30 is severe apnea.
People are waking up 30 times in 1 hour?
I have a patient who woke up 160 times per hour,
And they didn't know it. They didn't know it.
No, he still denies that he has sleep apnea, and we have the test, and we started treating him, and he comes in, I'm refreshed. I can go do all these projects that I never did. I can go out to dinner with my wife and not be tired. His wife came back and talked to us and was like, you know, Barry was this amazing man I married, and through the years he lost all this vitality, all this energy. We just kind of sat on the sofa because he never had the energy to go out, and now we're going to dinner. Now we have date night. Now we're going out with our friends. It's this amazing transformation.
Because he's sleeping.
Because he's sleeping. We all say, I think we all do this as well. We all complain that there's not enough time in the day to do all the things we want to do. But we all have the time. What we don't all have is we don't all have the energy.
And the motivation.
And the motivation to do the things that we want to do. Well, if you're sleeping properly at night and you're not waking up in the middle of the night, and I guess let me clarify one thing. You're not physically waking up. You're not like cognizant of the wake up. It's your body is subconsciously waking you up at night. So you could be completely unaware of how many times you're waking up, but it's disruptive on a neurotransmitter level, on a hormone level, from a neurologic level. The organs work harder. It's physically taxing to not be sleeping appropriately.
So when you get these people sleeping again, or at least breathing better, so they're not waking up, do they all say that? How soon before they say, God, I feel better? Because we all know what it's like not to sleep.
Oh my gosh, yeah.
Because you're not motivated if you don't sleep.
Yeah. So I mean, so there's two ways to look at it. I'm going to go a little nerdy here.
Okay.
So we measure REM sleep, non-REM sleep, and we measure a bunch of different things. When the non-REM and REM sleep is close enough on the reporting, I could give you the appliance today, and you would come back tomorrow and say, the fog is lifted. This is amazing.
Have you had that happen?
Oh, we do consults. I think like 10 consults a day. We treat sleep apnea and surgery primarily in my practice. Now we're a general practice and we treat everyone from 6 months old all the way to 106 months. So we do everything in the practice. But for myself specifically, I do surgery and I treat sleep apnea.
Are they surprised sometimes at the results?
They're shocked. And the beauty of it is their families are shocked as well.
Why?
Because so what happens over time is you see someone just slow down, and we think it's natural aging, like I said before. But then all of a sudden, it's like this reset button has been hit, and the patients and their families, they get to be a version of themselves that they always thought they could be, but never had the energy to be that way. And so what's the impact? Like, so Jeff, our patient, came in. We did a reconstructive procedure on him. He's a 4-year-old kid. But what's the impact to that 4-year-old to have a father through his upbringing that's more present, that has more energy, that does activities with his 4-year-old.
Because he's sleeping again.
Because he's just sleeping and sleeping properly. It's not the quantity of sleep. You could sleep for 8 hours and be exhausted. It's the quality of sleep. So Jeff is having quality of sleep, which allows him to be energetic with his 4-year-old. So that 4-year-old is going to have a better upbringing and have better vitality because Jeff is a better father, because of the restful sleep he's getting by just wearing a simple appliance.
It's that big of a problem? I mean, that many people have this?
Yeah. So when it comes to the appliances that we're selecting, I mean, right now there's about...
Appliance meaning the things you're putting in their mouths?
Correct. Okay. Correct. So there's about 140 different appliances. Well, what we need to know as dentists, as treating physicians, as the ENTs and the neurologists and the cardiologists and the treating dentists, we need to know what appliance fits that person specifically, because it's a customized appliance that needs to take into account how we're going to do that. That's where the tricky part gets. You need to know what person needs what appliance, and that is going to be the trick to resolve the issue and resolve it in a way where you're comfortable every single night wearing the appliance we're making for you.
You wear one of these?
I do. I actually have moderate apnea. So 9 years ago when I started treating sleep apnea, I would send people for tests. So I went and got the PSG at the hospital, the polysomnogram. I took a home sleep test, and over the years, I went from no apnea, and then 5 years later, as we recommend everyone gets tested every 5 years, even if you have no apnea, 5 years later, I skipped over mild and went straight into moderate. And so from that perspective...
Meaning what?
Meaning I wasn't sleeping, or I was waking up over 15 times per hour.
Wow.
And so, my team, they would have, because, I love my team, they're my second family. They'd put a sticky note on my computer with a smiley face or a frowny face. And, through the years, I started noticing I was getting more frowny faces. And I was like, I'm not showing up as the best version of myself. And, my team relies on me to be on point. My patients rely on me to be on point every single day, doing my best work. And as soon as I got this appliance in place, the fog was lifted for me. I was sleeping better. I was kinder and more empathetic and more fun to be around at the office. But here's the thing, and we both know this: you get a bad night of sleep, we're not fun to be around. People don't want to be around us. You know, like my wife married a very fun version of myself, and then to see myself get more miserable, it's like when we got married, I was in like this peak physical condition, and then if I let myself slip physically, that's not the person she married. Well, the same thing when it comes to energy. You know, if you marry someone and they have this vitality and beautiful energy about them, and then that deteriorates over the years, everybody wants to be around someone who's fun, who enjoys life. And so that's what this can really do. And what I've done in my practice is I like to focus on the things that change people's lives. Like, no patient stands up and gives me a hug after a filling or a crown. But if I give them this beautiful surgery, this reconstructive procedure we do, or I can help them sleep better and become a better version of themselves, that's where the magic is. And that's why we have this generational change in our practice.
Let me get this right, just so I understand how this works.
Yeah.
So somebody is walking around all day, they're breathing just fine. They're okay. They lay down, they go to sleep, the jaw drops back, the tongue drops back, and you make a custom-made, you're calling it an appliance, that kind of opens up the airway.
Correct.
So they're breathing. Is that
Absolutely.
kind of how it works?
Yeah. When we go to sleep, everything relaxes. So think about the airway like a tube. Air goes in and out. So if something is obstructing the flow in the tube, the tongue goes back, blocks off the airway, tonsils are large, adenoids are large, nasal passageway is constricted, whatever the case may be, it's multifactorial. But whatever is causing an obstruction in the airway, so it's like someone's basically putting a pillow over your face at night. You're not breathing appropriately every single night. So if we can resolve that with a very simple, comfortable, easy appliance, then the airway's open, adequate oxygenation, the heart's working better, the brain's working better. Your body as a whole needs to heal. Like, we call it recharging the battery. Every night, your brain heals and your body heals. So if there's underlying issues, like cardiologists now, if you have 2 medications for blood pressure, cardiologists are immediately saying we need to get the sleep addressed. If you're diabetic, there's a huge link between diabetes, cardiovascular disease, neurologic diseases, and sleep apnea. It's proven in the literature over and over again. It cannot be refuted. If people sleep better, everything as a whole will get healthier for you. And it's a very simple solution. You don't have to wear the mask and have the tornado or whirlwind in your mouth all night long. A simple appliance goes in and you breathe better every single night.
All right, we're gonna take a quick break, and we come back more about some of the, what diagnostic tools you're using to identify sleep apnea. You're watching the Wellness Hour. We're talking about the end of snoring and the end of sleep apnea. We'll be right back.
Dr. Dhoon noticed some chafing on my cheek and tongue and said that I grind my teeth during the night and that is a condition of sleep apnea. And I told him that I did have that, but I didn't know to what degree. And so he talked to me about, it's an appliance, they call it, and it shifts the back jaw back so that it opens up your airway and so that you can breathe through the night. Like I say, I knew that I had sleep apnea, but I didn't want to do a CPAP because it feels like you have a bug on your face or something, and I just didn't want to have anything to do with it. The exciting thing was about it is when the alarm went off in the morning and I got up, I wasn't in the normal fog, the cobwebs and like dredging to get out of bed. It wasn't there. I was completely alert. My mind was clear. It had been like I'd been up for a couple hours already. It was absolutely amazing. So if any of you have sleep apnea, you need to get this mouth appliance. I'm not kidding.
It's funny. Another thing that Dr. Dhoon helped me with is actually my sleep apnea. For years, I was just really, really tired. Didn't know why. But as I was getting older, I was dragging more and more. He was able to create a jaw repositioning device that not only helped with my sleep apnea and lower how many interruptions I was having a night, but also helped with snoring. So I don't snore anymore. So really appreciated to Dr. Dhoon and his team for making that happen for me.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, for those of you that are suffering from or been told you have sleep apnea or if your partner or spouse says you're a loud snorer, you got to hear what Dr. Dhoon has to say. So Dr. Dhoon, welcome back. So does it always start with snoring usually?
Well, oftentimes the snoring is a good indicator for people to come in and just get an evaluation. I think if you snore 100% of the time, you should get a sleep test. And so here's the thing, the spouses will oftentimes call us and make the appointment for whoever's doing the snoring. And it goes both ways. Now, in my practice, it's about 60% men who are having the sleep apnea treated and 40% women. So what we attempt to do with the spouses is they'll make the appointment for their significant other. You come in, we have a home sleep test, we do free consultations. You leave with the home sleep test, you get to sleep in your own bed, you don't have to go to the hospital and have all these electrodes put on you. Get a good night's rest at home.
Is it like a ring or what is it?
Yeah, so we have multiple home sleep tests now. So we have one that's as simple as just something that goes on your finger, just a quick ring that gets you a quick diagnostic result. And then we also have a test that has the nasal cannula, body straps, measures body position, how you're breathing, how many times you're desaturating or obstructing throughout the night. It measures your REM sleep, where the brain recharges, the non-REM sleep, where the body recharges. It's the technology on this has come so far that we get a lot of information where you don't have to go to the hospital.
Now, I haven't seen this diagnostic testing, but does it like have a readout that shows you from 1 to 3 and then 4 in the morning, you were stressed out, your heart rate was up, things like that, low oxygen levels, all of those things?
Yeah, it's really...
Does it show you that stuff?
It's really interesting you say that, because it basically prints out a graph and it will show you, we can see when you snore, your oxygen levels decrease, your heart rate increases. It'll show us your body position when this is happening, because sometimes we'll talk about positional therapy. We just don't make an appliance and say, good luck. We have ways to say, hey, positionally, you may want to talk about this. Diet, we need to control inflammation. We need a healthier diet. Well, so what happens when you're not getting adequate sleep? Hormones are off. Well, one of the specific hormones that are off is one that makes you want to eat carbohydrates. When you're exhausted, you want to go after sugars. Well, what happens if you eat a lot of carbohydrates? You're going to put on weight. Well, what happens when you put on weight? Your apnea gets worse. It's this vicious cycle. So inadequate sleep will make you binge eat, because your body is telling you, we need energy, we are depleted. There is a sleep debt that needs to be paid here. And what's unfair to the spouse is they're waking up with you. If you guys are still sleeping in the same room, they're waking up with you. So then they're also having those negative hormones coming out. So it negatively affects both people in the room. And that's oftentimes why the husband is in a different room than the wife. Or
do you hear that?
All the time.
Like the snoring is so loud that they got to sleep in the other room?
Yeah, I mean, I grew up with it. You know, my father snored so loud, you know, you could hear him through the wall. So oftentimes they would sleep in different beds. And the beauty of me getting into dentistry and my brother being an anesthesiologist and my mom being a retired nurse is we have a medical family. And so my mom treated children her entire career. My brother deals with the airway all the time. So we're all harping on my dad to get this treated. And as soon as we got him treated, the snoring went away. His energy level went up. They got back in the same bedroom. They got to like actually spend time together. He had this new vitality with his life. His jokes became more funny. His enthusiasm for life, the way he interacts with my kids, it's just so much more profound. So, and that's why I call it a generational type of treatment, is because I lived it. I have apnea. My father has apnea.
So that's why you're into it? Because you know, like, look, all of us, we find something that works. It's like, oh my God, I got to tell everybody about this.
Yeah.
Is that how you felt like when it worked for you?
Absolutely. And well, here's the beautiful thing about it is my patients feel the same way. So we barely have to talk about this. They tell their friends, because you know, a lot of people have friends who snore, just like a lot of people have friends who smoke cigarettes. And so it's like, if you have a friend who smokes cigarettes, you're like, hey, that's not good for you. Well, hey, guess what happened? This is how I quit smoking cigarettes. Well, this is how I cured my snoring. This is how I became closer with my wife. This is how I had more energy to go start that business, or to go to the gym and work out. Or Charlotte, who's this beautiful lady, and she loves fried green tomatoes. And she just didn't have the energy to go and maintain her garden.
She said this?
Oh my gosh, I hear these stories all the time. And so now she has the energy, because she's sleeping appropriately at night. She can spend time in the garden, make her fried green tomatoes. We still talk about that like every single time, because it's what lights her up. So whatever in your life lights you up, you have the energy to go and pursue those things, whatever it may be.
And so how old are the patients? Like, what are the age range? I know there's young kids, children. Yep. Parents need to know about that. But are they in their 70s, 80s? Is there a point where it's too late? for this type of custom therapy with these appliances?
It's never too late. And even if you don't have teeth, because we're a surgical center as well, we can place the implants that are needed to restore your teeth to the way they need it to be, so you can chew the healthier foods that your physicians and your primary cares want you to eat, to ward off diabetes, improve the GI, help you be healthier. But then at the same time, those implants are going to help us to make the appliance to open the airway.
So people with like bad gum disease or currently wearing dentures, they have it too. So you can correct that?
Absolutely.
With what you're doing?
Absolutely. Okay. Because the beauty of what we set up at our practice is, because we treat everything, you don't have to go to 4 or 5 different offices. So when I was growing up, I had to go to the general dentist, I had to go to the oral surgeon for my wisdom teeth, I had to go to the orthodontist for my orthodontics, and it was like difficult for my parents to drive us around to all of that and do all the sports and do all this. It's like taxing for parents to have to take all their kids to all these different locations. So what we've created is a place where you can get everything done. The parents can get their apnea treated, the kids can get their apnea diagnosed at an early age to hopefully keep them from ever having to deal with the problems that we're talking about today. We treat orthodontics, we do surgery all in one place.
Because nobody likes going to the dentist, right? So it's nice if you could go to one place.
Well, I don't like being in the chair if I have to be in the chair. But because of that, we figured out ways to make this easy for the families and get everything done at the highest clinical level possible.
I got to back up, because you offer the free consultation and the initial sleep test is free. And I was telling you off camera, there's a guy here in San Diego that charges $1,500 for that.
Yeah. I mean, so that blows my mind.
That's nice, though, that you're doing that.
Well, I think it's a service. So the community has been really good to us, and what our job is as people who care for the community and being a pillar in the community is to make the barrier to entry for knowledge accessible. And getting these sleep tests, with the advent of technology, it's not expensive to do anymore. So I don't have to charge $1,500. We do the first consultation for free. We do your first test for free because I'm nerdy and I want to know the information. I need to have the diagnosis to treat people appropriately because the left brain in me needs the analytics. But also secondarily, there's so many people who need to have this treatment done and they need the knowledge to treat it.
In addition to them feeling better, them reporting they have more energy, do you show them the data, like a before and after?
Always.
That it's working?
Always. So we had this patient named Ben, this like really, really like amazing old guy, kind of crotchety sometimes, but still hilarious. He's just like family in the practice. And so for him, he was always like, I'm Mr. Skeptical. He's always skeptical about sleep apnea. So we did the first test. Then he had the appliance, and I had the second test. We pushed him from severe, because he would, he's old and ornery.
What does severe mean?
Severe sleep apnea. He stopped breathing 40 times per hour.
Okay.
And he just thought that this was regular life. This is what age meant to him. And then after we treated him, he didn't even register with any apnea. He had only 3 events happening every hour. And if you hit 5 events per hour, that's when you're mild. So we took him from severe to sub-mild with 1 appliance and in 1 month. It was amazing. And then, of course, he wasn't skeptical anymore. I mean, Randy.
What happened? What did he say?
Oh, I mean, he was just like, I have all this energy. Doc, you were right. I like hearing that one every once in a while, especially out of the skeptical guys. But, Randy, you interview medical doctors on your show all the time. What are they saying about sleep?
Yeah, I mean, just about every medical doctor it agrees, especially with integrative functional medicine, that you've got to get checked for sleep apnea. And you also have to look for gum disease, which is one of the things you treat. But in every book, even the end of Alzheimer's, Bredesen talks about apnea is one of the contributing factors to Alzheimer's. Gundry, the heart surgeon that's writing all these books, get checked for gum disease, also get checked for apnea. So it's become mainstream.
Yeah.
And so more and more medical doctors across the country are just, and the so-called top guys, all agree this is an issue. And they say patients, like, they don't want to take their advice. They'll listen to a bunch of other things. Oh, yeah, but I don't want to, because they're asleep and they don't even know what's going on.
Yeah.
So that's your challenge too.
Well, absolutely. And another thing I want to bring up is, people are living longer. So from a dental perspective, I have to make their teeth last longer. Well, we have to make the brain and the neurology be more functional at end of life.
Can we skip to kids for just a second? We have about a minute left. But so if your child, because you're not sleeping in the same room with the child, so you don't know if they're gasping for air or whatever.
Yeah.
Is it, you just judge it based on how hard it is to get them out of the bed in the morning, or do they look tired?
Yeah,
Are there any signs that you could give tips to parents?
Absolutely. So like I said earlier in the show, I have 3 kids under 5. My 5-year-old actually has a sleep issue. So we are expanding his upper arch. If you expand the roof of the mouth, it's the floor of the nose. So you're making the nasal passageway bigger, so they're going to be breathing through their nose more. Well, if you breathe through your nose, it shrinks your adenoids and tonsils. So if the kids have small adenoids and tonsils, well, guess what? They can maybe prevent a very painful surgery to remove the tonsils. To answer the question you brought up for parents, if the kids are grinding their teeth, if the kids are snoring, or if the kids are having bedwetting issues, it means they might not be in a deep enough level of sleep, so then the bladder is not in a deep enough level of sleep, so the bladder is overactive. So these are the things to watch for. Or just your kid looks tired, they have bags under their eyes, or their mouth is just hanging open. All of these things are signs and symptoms of early onset sleep apnea in children. And here's the thing, with kids especially, they're going through such exponential growth curves, neurologically speaking, physically speaking, that they need good rest to become the best versions of themselves. They've linked IQ in children to 10 points, which is super significant if they get better sleep and adequate oxygenation of the brain. So I'm super passionate about getting these kids sleeping properly from a young age.
So final message, somebody watching this, and we talked kind of jokingly in the green room that we're dealing with a grumpy, skeptical, moody group of people that aren't sleeping. They think they're sleeping and they're not. So it's hard to motivate them to do this. What do you say to the person, maybe the spouse is watching this, the partner, what do you say to them? They've heard what you had to say, but they're skeptical.
Yeah, I would say it's just like someone who has bad teeth who doesn't smile because they're embarrassed of their smile. We confuse those people or those patients as unhappy people. Well, they're not unhappy people. We confuse people who are exhausted and who don't have energy to go do these things and spend time with their families as people who are just getting older or aging or having something going on. I think everybody owes it to themselves to figure out if there's something that can be easily corrected that can literally change the trajectory of their lives, but also their families' lives. And that's why we do the free consultation. Good. So I think it's beneficial for everyone to at least find out if this is something that could benefit them.
All right, good. I want to thank you for coming on the show. Always a pleasure. And if they want to make an appointment, they just go to the website.
Absolutely.
See it. And you have a massive team over there, we should mention.
Yeah.
You're probably the busiest in Colorado for sleep disorders?
Probably at this point, we're the premier implant center in Northern Colorado, and as well as sleep apnea. Good for you. Thanks again. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.